diagnosis. Fibroids, also called Miom in Indonesia, it is a muscle growth. It's a muscle growth in the womb. It's different from a kysta. Kysta are cysts in the ovary. This Miom is in the muscle, okay? And it is, most of the time, is non-cancerous. Only about less than 1% is cancer. So it depends on the size. So it is, if it is in the muscle itself, it's called intramural fibroids. If it bumps up, push up outside the womb, from here it push up, it's called subserosal. But if it goes into the cavity, it's called submucosal. When the whole thing is inside the cavity, it's called intracavitary. Sometimes the subserous push up, grow up a little bit more, then it becomes a stalk here. We call it pedunculated fibroids. So it depends on the place. Then it has various size and symptoms. So the size can be very small, like a pea size, sometimes as big as a watermelon, small watermelon. So what are the causes of fibroids? Most of the time, we do not know what causes the fibroids. But we do know that sometimes it can run in the family. There's some genetic reasons. And it is related to hormones. In other words, if during pregnancy there's a lot of hormones, then the fibroids can grow. Whereas after menopause, when there is no more hormones, then the fibroid will not grow and they become smaller. Okay, so these are the causes of fibroids. The symptoms depends on where the womb is. If it is in the womb itself, it can cause a lot of bleeding. The bleeding can be very heavy, sometimes with clots, sometimes very irregular. In other words, every month, instead of 1 month, one time becomes 1 month, 2, 3 times. Very irregular and sometimes very long. Instead of 7 days, it stops. It may go on to 8 days, 9 days, 10 days, 2 weeks, 3 weeks. And sometimes about a lot of spotting in between period. So that is if the Miom is inside the womb. Now, if it grow outside the womb, it can cause pressure. In other words, sometimes you can feel your tummy very, very uncomfortable at the lower part. Sometimes you can even feel the lump if it is very big. You can feel a hard lump at the lower part of the abdomen. And if you're pressing on the bladder, you feel like going to pass urine very often. You drink a little bit of water, you want to go to the toilet already. Sometimes if you press on the rectum, that's the intestine, then you feel like going to pass motion or sometimes constipation. Some people sometimes have backaches because it's pulled onto the nerve. And it can cause pain during menstruations. Most teenagers will have pain, but usually when they are in the 20s, the menstrual pain will get less. But if they have fibroids, they can have pain when in their 30 years old, 40 years old. Every time the menses come, it can be painful from the first day to the second day to the third day and so on. Sometimes during sex, when you touch the fibroid, it can be painful. And sometimes, even if no sex, no menses, you feel the back very heavy and can be very painful. And because it bleeds a lot of the time, some people get very low hemoglobin. We call it anemia. Anemia means they are very tired. During menstruation, they lose a lot of blood. They feel very tired. They look very pale, sometimes breathless. They walk a little bit. They feel very, very breathless. Okay, so these are some of the symptoms and signs of fibroids.